ask, I'm not sure. There you go. I was just to say, I don't know if it was recording. So that's great. Okay. So thanks again. And I appreciate you writing your questions in the chat, and Mary's going to help me monitor that. I will answer all questions towards the end, just because the presentation kind of builds on information as we go along, but write your questions down so you don't forget, so we can remember to circle back. And also, if you don't think of questions right away, but you want to email me, my email is on the last slide. I am always, happy to brainstorm. So you can email me, we can brainstorm any solutions or any, for any potential problems that you might be having later on down the line. So please always feel free to email me. So let's go ahead and get started. So I have no disclosures or conflicts. So I always start these presentations with just some very basic foundational information. So it's important that you recognize that hoarding disorder is a recognized diagnosis in the DSM-5, which is the Diagnosis and Statistical Manual of Mental Disorders. It's really the authoritative guide for diagnosing all kinds of mental disorders. And prior to the DSM-5, hoarding behaviors were actually lumped in with a type of obsessive compulsive disorder. But now it's recognized as its own disorder because roughly only 20% of people struggling with these behaviors also have OCD. It's a mental health condition in which a person feels a strong need to save an excessive number of items, regardless of the monetary value of those items. It includes the accumulation of and failure to discard possessions, which results in impairments to their daily life, their health, and their safety. And it's important to note that underlying mental and physical health conditions should be addressed if you want to give yourself the best chance to see any behavior change in these behaviors, but that hoarding itself is not related to other medical conditions. So the most common question I get is it clutter? Is it a collection? Or is it really hoarding behaviors? So clutter is just usually disorganized stuff. It's piled together everywhere, maybe on the floor, maybe on tabletops, but it usually doesn't interfere with daily life. Collectors, on the other hand, they look for specific items. They often organize those items and display them appropriately. They're very proud of them. And in general, we can all agree that most of those items have a monetary or a sentimental value. Think of art, stamps, coins, comic books, those types of things. Hoarding behavior is more than being messy or having a lot of stuff. It causes clinically significant distress, and people struggling with these behaviors often have a strong urge to save the items, and they have a persistent difficulty in discarding them, regardless of what the item is, regardless of the monetary value. A key question you can always ask yourself to really see if you're working with somebody who is struggling with hoarding behaviors is the amount of possessions that the person has, is it interfering with the way the room it was intended to be used? Is there so much stuff on the bed that they can't sleep in it? Or have they just left a little, maybe 2 or 3 feet on the side of the bed where they could just lay down, but the rest of the bed is full? Do they have so much stuff and piles throughout the home that they've actually developed and created pathways that they have to use to get around their own home? Are the exits blocked? Can they use the bathroom, or is there so much stuff in there? Is the stove safe to use, or is there stuff piled on it or inside the oven? Is there rotten food in a very crowded refrigerator? Those are some often really key signs that you're working with somebody who definitely is struggling with hoarding behaviors. So prevalence, it's estimated that roughly 5 to 6% of the United States population struggles with these behaviors. That's about 17 to 20 plus million people. And the prevalence is similar in other countries, Germany, the UK, France. This is not specific to the United States in any way. The prevalence is similar for men and women. However, women seek treatment more often, and the average age of treatment of people in treatment is around 50. And even though there's lots of references to hoarding that goes back, even beyond the 1800s, we've really only been studying hoarding since the 1990s. And originally, people thought that hoarding had something to do with aging, because most of the people involved were older adults. However, due to a lot of research, we've discovered that the average age of onset is actually between about the age of 11 and 17 or 18 years old. And the behavior starts to cause significant impairment to the person's life, usually around their mid-30s, early to mid-30s. The behaviors are somewhat controlled throughout their life from social cues from parents, roommates, spouses. But as we age, we tend to care a little less about social cues. And after a lifetime of saving and acquiring and not discarding any items, these behaviors get harder and harder to hide as the person gets older. So often people struggling with these behaviors, you might also notice that they exhibit difficulties with executive function skills, things like decision-making, time management, making a plan, sticking to the plan, and achieving goals. Those can also be cues that someone might struggle with hoarding behaviors and or hoarding disorder. Family history is very common. About 84% of people will have a first-degree family relative that also struggles with these behaviors. And it's really important to recognize that these behaviors occur in all cultures, at all income levels, all education levels. You could very likely know someone who personally or work with someone who struggles with these behaviors, but unless you visited their home, you may never know. People who struggle with these behaviors are often very successful professionally. So how are the items acquired? So there's a few ways. The most common can be compulsive buying, retail or online shopping. There's compulsive acquiring of free things. So think of all the things that you get when you go to a conference, the swag stuff, the flyers, you pick up stuff at every single table. And if you brought all of that home and never got rid of it, think of that. Flyers are handed out everywhere we go. They're put on our front doors, on our cars, in parking lots, in front of stores. And some people with these behaviors might even dumpster dive for other items that they are looking for. There's passive acquisition, junk mail, food packaging. Think of all the things that we bring into our house on a daily basis. And if we never discard any, you can see how it can build. The most common items acquired are paper. About 80% of people, 80% of items acquired are related to paper. This includes books, mail, journals, stuff like that. Clothing makes up about 63% of items, and other common items will include like family heirlooms, personal possessions, hobby and craft items, furniture, electronics, and food. Only about 14% will hoard only one category of item, but most, about 65% of people, will hoard 3 or more categories of items. Pets can often be present in these cases, about a quarter of the cases, but that doesn't automatically mean that there's an animal hoarding situation. So they can have pets and still not be hoarding animals. So that's important to recognize the difference. And squalor, which is true filth, not clutter, it's human waste, rotting food, that type of stuff, that is present in about a third of the cases. So why are the items saved? So it usually comes down to 2 reasons. It's either sentimental or instrumental. So sentimental, this is a part of me. It represents my life. It can be a family heirloom or a to-do list, saved because they're afraid they'll forget something if the item is not present, if they can't see it. They'll justify saving things like, I went to the bank last Tuesday and I saw Nancy, and I want to remember that Nancy told me about this great new store, so I need to save my to-do list so I remember to go to the store and check it out. Other reasons they can save items can be for instrumental reasons. I can use this. There's an opportunity lost if I throw this item away. I have a responsibility to make sure that items are used again. And people who struggle with these behaviors often recognize they're very creative, and they often recognize that there's multiple uses for every item. So an example might be that they save the paper towel cardboard roll, because everybody knows that elementary school teachers all across the United States use these for art projects. And so they want to save them because they want to be useful, and this item can be used again. The disconnect is that no one's asked them to save the item. They haven't found a teacher who wants the items. And so the cardboard rolls actually never leave the home. So they have a good reason for saving it, very logical, but there's a big disconnect between why I'm saving and am I actually going to discard these items? So there's a lot of issues with discarding, and really the big one is there is severe emotional distress when they think or attempt to discard items. Common emotions are depression, anxiety, hopelessness, shame, embarrassment, guilt. Many may feel angry and get defensive. They can simply be overwhelmed by the burden of their possessions. All of these emotions can be experienced by people who are struggling with these behaviors. They often lack an awareness of the severity of their behavior. Some people struggling with these behaviors, some might have good or fair insight into the issue. They may recognize that their behaviors are problematic and unhealthy, but they still can't control them. But most have fairly poor insight and generally feel that their behaviors are not really all that problematic, despite all evidence to the contrary. It's also really important to understand that emotions and motivation to change can really change quickly when you're working with people that struggle with these behaviors. I'm sure most of you have seen the show Hoarders on A&E. There's a whole bunch of varieties of this show now. And while I feel that these shows really sensationalize these behaviors, the show does clearly show how motivation to change really fluctuates. So at the start of the show, the person is excited. They welcome the help. They're eager to get started. About 15 to 20 minutes later, their anxiety starts to set in. They don't like how things are going. They don't like that people are touching their stuff. And about 20 minutes later, the fear sets in. They want the workers to leave. It's too much, too fast, and they decide they're going to do it for themselves. And often by the end of the show, they will comment that they don't understand why everybody has a problem with their possessions. It's really I don't have a problem. You have the problem. I'm fine. And that's very common. So when you're working with individuals that are struggling with these behaviors, you can expect that and be prepared for to talk them through it, but be prepared for it. It will really, so it doesn't shock you when it happens, how quickly it can happen, because literally the show has it right. From within an hour, we can go for I'm 100% on board to get out of my house. I don't want you here. So be prepared for that. It will help you. It will help you move forward. The results of this successive and consistent acquiring and failing to discard really leads to significant disorganization. The clutter just builds. The piles get higher and higher. And it's really important for everyone to know that the pile contains items of mixed importance. So they don't organize these piles. There's not one pile for very important documents and one pile for mail and one pile for books I want to read. Usually it's all sort of mixed in. So in one pile, you can find junk mail, maybe cash, maybe the deed to the house, and maybe the to-do notes that we talked about, or the list of things, advertisements that they want to save because they want to remember to go various places. All of that can be mixed in. Back in the early, before research really started to get done, people used to do these forced cleanouts, and they would just sort of go in, and basically throw everything out. And over time, we realize that you can't do that because you are often throwing out very, very valuable items that the person needs, important documents and money. I've heard one story where they did a clean out and they found $35,000 in $1 bills all throughout the house, all mixed in those piles. So you need to recognize that. Often they have a fear of putting things out of sight. They might forget where it is, or sometimes they just want the visual reminder to do something. They're afraid they're going to forget stuff. And they're also afraid they're going to make the wrong decision. A resident might struggle in making a decision, say, they have a bunch of stuff in their room and they want to fill up their closet, but they're not quite sure like what order they should put in their closet. What goes in the back? What goes in the front? What if I put something in the back, but I really want it in the front and now I can't reach it and it's out of my reach, and now what am I going to do? So they go back and forth on making a decision. And for all of us, when we can't make a decision, ultimately we just hold off making that decision. And so they hold off as well. No decision is made. About 80 to 90% of those struggling with these behaviors will continue to acquire items regardless of available space or need. And the cycle just repeats over and over and over. They will never wake up one day and say, you know what, I'm good. I got enough stuff. I don't need to keep doing this. They will continue to acquire, and the situation will continue to deteriorate until they get help. So what kind of health and safety risks are there for these people? So for the individual, there is clearly an increased risk for falls and other accidents. And because of all the items in the dwelling, emergency help often can't get inside to get them out. There can be a high risk of infections, respiratory issues from dust, mildew, or mold. There's personal hygiene issues, and always there's a risk of eviction. And shelters have been known to turn away people with known hoarding behaviors. It is a public health issue. It really is. There is an increased risk of fire, rodent infestation, which can spread bacteria and disease and viruses. There can be pest infestations. Mosquitoes can spread West Nile virus. Ticks can spread Lyme disease. Other bugs can carry and spread bacteria such as E. coli or Salmonella. Cockroaches can contribute to childhood asthma and allergies, and they also spread bacteria. So people who struggle with these behaviors often want to address these issues because they want to address issues that are happening within their home because they don't want people inside. So leaks go unfixed, roofs go unfixed. If the bathroom is not working, the shower or the toilet, they'll go unfixed. Things continue to deteriorate, hazards continue to grow. And so there's a high risk to others who live in or near the environment because of these situations. So these situations really can't be ignored. We have to solve them one way or the other. The San Francisco Hoarding Task Force was able to do a very extensive research project, and they were able to quantify the cost for compulsive hoarding for their city. San Francisco is a pretty big sized city, so I think these costs are very justified. Estimated costs are about over $6 million every year. Organizations reported higher costs for individuals with hoarding behaviors compared to other clients, ranging anywhere from $50 to $20,000 per client, with a mean of about $3,200 per client. And it's important to note that the cost of those forced cleanouts that I mentioned can be anywhere from $3,000 and up. I've heard as high as $15,000 or $20,000. They average between 15 and 20. And I think that just, again, that depends on where you live, but that is a frequent number that I hear. And again, it will depend on the size of the dwelling and what kind of resources are available in that area. When those forced cleanouts happen, since there's usually no behavior modification or even counseling that can happen when those forced cleanouts occur, the resident usually just reacquires item, often at a faster pace, to reduce their own anxiety. So usually within 16 to 18 months, they can be right back where they were before the clean out even happened. So often that can be just a huge waste of money. So assessment tools, there are a lot of assessment tools. You just have to Google. There's a ton of them out there. The one that I really like is called the Clutter Image Rating Scale. It's developed by Dr. Randy Frost. And if you want to look at any research related to hoarding, I would really look him up. He's got some great stuff out there. Dr. Frost rented an apartment with a bunch of college students, and they slowly filled it up. He has 9 photos of the kitchen, bedroom, and living room to show the increasing levels of clutter. And each photo progression is worth 1 point. So the scale is 1 through 9. And a rating of 4 or higher indicates a significant issue with hoarding behaviors. I really like the use of photos. They can really help you get an accurate sense of the situation. And it can also be helped to show improvement. So the resident and landlords can be shown these pictures, and often sometimes the court system when they're involved, if you're trying to get approval for more time before the resident is evicted, you can show that progress is being made. And also for the resident to see the progress, I think it can be very motivating to see that even though it doesn't look like much, or they might forget, but there is progress being made. So these are the photos. I'm not sure how clearly you can see them, but look them up if you can't see them very clearly. But there's 9 photos. So here's 1, 2, and 3. And you can see the clutter slowly start to build. Okay. So when we get beyond picture 3, you'll see picture 4. And anyone living in a home like this is really going to have issues moving about freely. The person struggling with hoarding behaviors at this point really should be strongly urged to get some help. You can see that as the clutter progresses, the safety issues also progress. They can't really walk around. There's stuff on the stove. I can't see to get into maybe the fridge here. And there's stuff on top now as well. By photos 5 and 6, you can see that health and safety risks, blocked exits are probably likely, and there's extreme fire hazard. Look at all the paper material that's there. And then 7, 8, and 9, really, there's no egress here. Like, we have a significant problem. If a person living in this dwelling fell, emergency personnel would have a hard time getting in to help them. If there was a fire, the person would have a hard time getting out. So communication tips. First and foremost, be respectful. I know that seems like common sense, but it can be hard to do. So be respectful. Your goal is to be as non-judgmental as possible in both your words and your behaviors. This is very important. Don't let your surprise, disgust, or confusion show on your face. They are watching for it. Remember that they have had a lifetime of people talking to them about their possessions. Their defensive guards are already up. So you have to build trust to kind of break that wall down so they're hearing what you have to say. Use their language. If they call it treasures, call it treasures. If they call it a collection, that's fine. Or if they just call it their stuff, that's fine too. Whatever words they're using, you use. Don't call it junk or trash. Don't imply that it's worthless or meaningless. Demonstrate that you understand that you value their belongings. They value their belongings. You understand this. And don't touch their stuff without asking. Don't call them a hoarder. Even if they call themselves a hoarder, don't do it. I always do my best to phrase it as hoarding behaviors or the hoarding environment. If you call them a hoarder, they're going to feel like you're calling them a name and you're judging them. So again, that wall comes up, and your whole goal is to get that wall to come down so they can really hear what you're trying to say. Don't impose your feelings on them. Don't say things like, you will feel better if we just do this. If I can help you get to a more manageable situation, I promise you will feel better. because I promise you, they will not feel better. You will feel better. They are going to be very stressed about making those kinds of changes. Focus on the issues when you're talking to them, not the underlying causes. Don't get trapped into a conversation about why they're having these behaviors, because really at that point, it doesn't matter what's happened in their past or what's going on with them as to the why. You just need to deal with the here and now. So if you get trapped in those conversations, keep trying to bring them back to, we just want to deal with the here and now. I want you safe now. Let's not talk about how we got here. The fact is we're here now. Let's talk about right now. And really talk to them that they can talk to a counselor if they really wanted to get into the deep why this is happening. That's more for work for counselors, and you're not a counselor. You're just trying to help them right now. Your goal is to help them understand that you are willing to work with them. You understand what's happening. You understand it's a mental health condition, and that you're willing to work with them. No one wants to see them move, or worse, become homeless. That is not the goal. You are on their side. But things have to change, and they have to work hard to make those changes. We're going to talk about some strategies in a minute, but just the communication, the back and forth that you're going to have, be very clear what has to happen. You understand, but changes have to be made. And if you're calm and non-judgmental, they are more likely to hear the words that you're trying to say and to trust that you're on their side. So communication barriers, keep in mind that they can have different solutions, where your solution might be, let's, really throw a lot of this stuff out, like the trash and the food and the things that are bringing the bugs in. Let's throw this out. Maybe they want to talk to you first about reorganizing and not discarding. Maybe they would rather put things in some large containers as opposed to throw away. And overall kind of expect that they might just be really frustrated because they may really not believe that you understand how valuable all of their stuff is. So that's really important that you show that you do recognize how valuable all of their stuff is. They're very afraid that you're just going to throw the stuff out. Remember that they've seen these shows too on the hoarder shows on A&E, and they've had a lifetime of bad experiences related to their possessions. No one has ever said, God, this is so great that, you have all this stuff, or I love what you've done with the place. They don't ever get positive feedback like that. It's always negative. So they're always prepared for the worst. Remember that progress can be really slow. And while it may appear that they're not making any progress with reorganization or even discarding, remember that they may have spent hours just trying to make decisions. So lack of progress doesn't always mean they haven't been trying. They may have really, really been trying, but because they struggle with decision making, it's a very slow process. Remember the executive function deficits, and remember that they may sit in front of a pile and try to sort. And while you and if I put a pile of stuff in front of you, let's say I put a pile of clothes in front of you and say, sort this pile. Most of us might sort into like 3 categories. We might say, tops, pants, tops, shoes. We might sort by weather, maybe winter clothes or summer clothes or something like that. We'll have some sort of system, but maybe, ultimately, on average, I would say we're going to have about 3 piles once we sort it out. People with hoarding behaviors might have 15 piles by the time they're done sorting. They might sort by clothing type, maybe silk or cotton, or how it has to be taken care of, in addition to summer or winter or fall. They may sort by if the item is new or if it's older. Shoes can have also separate piles related to, are these shoes that are dressy shoes? Or are they outside shoes? Are they gardening shoes? Are they running shoes? So keep all of this in mind when you're working with someone, because it will help you understand the way that their mind is working, because it's going to be different from the way that your mind is working. So first and foremost, remember, it's a mental health issue. The people struggling with these behaviors are not being difficult and unreasonable. They are not trying to cause problems. There really is a mental health issue happening. Counseling and or family, friends, landlord support, all that kind of support is really critical to their success. They really need someone on their side. They need a partner and someone they can count on and not judge them. And the goal, remember, is safety and improvement, not perfection. So we can't put our own standards of how we live onto them. So and that, trust me, is easier said than done. So the more you know, sort of going into these situations and working with these clients, the more easier it will be for you to become across as open and non-judgmental, because you'll really understand the way that they're thinking and how different it is from the way that you might be thinking. So cognitive behavioral therapy is great therapy. It focuses on creating a different relationship with their items. It can be very successful. And a lot of the work in CBT involves things like helping them learn how to organize and sort and discard and make decisions, and learning how to control the urge to acquire new possessions. It can really help them learn to manage this condition. And even though there's a high risk of relapse, if they stick with it, it really can be beneficial. So I always encourage people I work with to get outside counseling. It can be really important. The trick is finding a counselor who is familiar with hoarding disorder. That can often be quite difficult. So you might have to do some research to help them find somebody. So harm reduction strategy, I often feel this can be the most successful. It helps you manage the symptoms and decrease the risk involved. You start small with open communication, remembering that the person has to feel safe and emotionally supported. They have to trust you. Take photos. It can demonstrate progress. So before anything is done, take some photos. And in a few weeks, you can show them the photos and you can demonstrate what's been done and what hasn't been done. And get creative. Use visual reminders to help them reach their goals. You can use painter's tape as a visual reminder to keep clutter maybe 2 feet away from the stove or doors to make sure that they fully open or close. You can also use it on the walls to remind them that the piles can't get any higher than the tape. 3 feet is usually a good goal. No piles higher than 3 feet. That way they can see over them and they can know what's happening on the other side of the room. You can discuss ideas on how to limit incoming clutter. Maybe they can limit magazine subscriptions to maybe 2 a year. Maybe they can limit themselves to only buying one clothing purchase a week or a month or something. You can come to some sort of agreement, but having those conversations can be really important. Focus on safety. If the person needs to be able to walk around safely, talk to them about them. Talk to them about the needs for the pathways to be clear so they don't trip and fall. Have them think about what would happen if they got hurt or had a heart attack and the first responders couldn't get in. What if there was a fire and they couldn't get out? What would happen to their kids or their pets or anyone living nearby? How would they feel if they had a fire and their neighbor was also impacted due to that fire? Bring up those situations and really have them think about them. What would that mean to them? If they're at risk for eviction, ask them if they have a plan. Where will they go? Be clear with the rules and what will happen if you can't help them. Make their space safe for them and for others. So you have to be firm, but you have to be kind. And you have to be really clear with your language. Those can be really important. Also, remember that any progress that they make, no matter how small, praise them for it. And remember how difficult it was for them to make any progress at all. So praise frequently and genuinely. That can really, really be helpful. Discuss the importance of going to a doctor for a good checkup. It's important to address and treat any underlying conditions. Data from about 2011 has shown that people diagnosed with hoarding disorder, up to about 57–60% also have a diagnosis of depression. About 29% suffer from social phobias. 28% have generalized anxiety disorder, and others have attention deficit disorder. So treating these co-occurring conditions won't cure or prevent the hoarding behaviors, but it can help the person feel the best they can feel while they're trying to learn new skills to reduce their hoarding behaviors. Remember that no two hoarding situations are identical. So what works for one client may not work for another client. And each interaction between the person, the severity of their behaviors, their environment, and each case, it requires a new plan. So just sort of keep that in mind as you're working with your clients, that they're all different. The reasons they hoard will be different. What's happening in their own environment will be different, and the solutions that are acceptable to them will be different. So be really open and be sort of prepared to start the new conversations with each client. You won't be able to, it's highly doubtful you'll be able to repeat the same exact strategy from case to case. So why does it take so long? So remember that they've had these behaviors since adolescence. Happened over a lifetime. That's a long, long time. And behavior modification is hard for all of us. Think, if you've ever had a diet, I needed to diet. That's behavior modification. It's hard. We make 2 steps forward, 1 step back. It's the same for people who are struggling with these hoarding behaviors. It takes time to learn new thinking and new behavior skills, and to keep up with it. So try to recognize that, remember that, tell them that you understand, you know that it needs time, that change is hard, but be confident they can do it. They can do this, and they have to do it, especially if they're facing eviction. This is not a great scenario, but change has to happen. So I often get this question: has there been an increase in hoarding cases since the pandemic? So you might have noticed an increase in the number of hoarding cases in your area. There's been a lot of media reports, and some research studies indicated that during the pandemic, people who struggle with hoarding behaviors experienced greater feelings of helplessness and sadness, and more distress related to their hoarding behaviors during the pandemic. And remember that hoarding behaviors are chronic and lifelong. The reasons for hoarding behaviors really go beyond the emergency stockpiling or panic buying that we heard. Hoarding behaviors and stockpiling or panic buying are very different. Stockpiling is not related to a psychiatric condition. It's normal, planned behavior, especially when we're faced with some sort of shortage. But it can get excessive. We all remember the toilet paper craze and all the media that was around that. Panic buying is impulsive, but it's a temporary reaction to anxiety caused by an impending crisis. It's not lifelong. It starts and it stops. People with hoarding behaviors won't be able to get rid of the things that they bought during the pandemic. Like if they did buy a bunch of toilet paper, if they fed into that, they will have a hard time discarding that when the pandemic is over, when the shortage is over. But people who stockpile, or the panic buyers, they will be able to get rid of the items. They won't feel the strong need to continue to acquire the same items after the crisis is over, and they'll be able to use them and then go back to having normal quantities in their home. So this book, I think, is the best book. This book is called Buried in Treasures. It's a great resource. It's available on Amazon. I think it's maybe anywhere from $12 to maybe $16. I highly recommend it, not only for individuals struggling with these behaviors, but it can also help family members understand the behaviors and the thinking process that their loved ones is going through. And it's great for professionals as well. Each chapter has exercises which you can find to be really helpful, and you can use these exercises with your clients. In 2012, I founded the Southern Arizona Hoarding Task Force. I attend a lot of community meetings, and I was being asked a lot of questions relating to hoarding environments. And I didn't know anything about hoarding at that time, but I came to realize that really no one did. Everybody sort of knew their small piece of the pie professionally, but they didn't know how to help their clients because they didn't know what everybody else did. So what we did for the first couple of years is just get everybody together and talk about what services they offered relating to hoarding. It seemed like a very fixable problem to me. Easy, get a bunch of people together. We had about 60 agencies involved, over 100 people. They all attended meetings, and we just shared what everybody did. Everybody took turns presenting on the services that they offered. So everybody knew basically in Southern Arizona where you could find help for your clients. In 2015, meeting attendance started to drop off a bit because the education was out there, and we decided it was time to really start do something for the community, for the people actually struggling with these behaviors. So we transitioned to more of a community action model, and we started the Hope Workshop, so people could learn how to organize, purge, and end the cycle. That's where Hope came in. I partnered with Jennifer Kerrigan, who works at our Pima Council on Aging, which is our area agency on aging. And we worked together for 5 years. We offered these workshops for 10 weeks, twice a year. They were 90 minutes once a week. And we used this book. The class was open to only people with hoarding behaviors, not clinicians, not family members, nobody else. So we just got a bunch of people in the room who were able to communicate and talk to people who had similar issues. And that honestly was more important than anything I did. Just sort of that peer-to-peer support was really crucial with these workshops. Each session focused on a specific topic. We had assigned homework, which include things like reading, emotional journaling, photographing progress, and individual behavior modification strategies. And I really need to get it going again, but since the pandemic, we've had some issues related to time and funding. But it can be very successful. And again, I really recommend this book. So that's really the gist of everything. So I would love to know if you guys have any questions. And again, here's my email. Feel free to email me at any time. And let me know if you have any questions. I'm going to stop sharing my screen. Okay. So are there any? I have not been keeping track of the chat.
I have been watching the chat,
Okay.
and I do not see any new questions. Does anybody have anything that they'd like to ask Lisa?
So again, feel free
to
reach out to me at any point if you have questions later on too. Sometimes it's hard to come up with questions right away. There's a lot of information thrown at you. So, yes, I can put my email in the chat. Spell it right.
Karen, do you want to just unmute and
Yeah.
ask a question?
Yes, I did. So we had a situation where, and I know you said that the hoarding does not necessarily relate to any other medical conditions or anything like that, but oh my goodness, we found, goodness gracious, we could have had remember those old wine bottles where you would melt the candle? We could have done that for the entire county. This was really bad. I mean, really, really bad. And we had a young woman who worked with the woman and gained her trust. And it seems to be all cleaned out now. But
It's
6
shocking.
months later.
It's shocking.
Well, it is shocking, but
Yeah.
I'm concerned about this problem. How do I know she's an alcoholic? Well,
You
can't
don't.
say that I don't.
You don't,
I
unless you're going, I would say this, for people that I was responsible for, I would continue to check, even This is sort of like an ongoing forever process because they're not going to be cured. Even though you can talk to them and they can make progress, they're all so I have to be careful when I say this because addiction and mental health issues are very different. But I often relate it when I'm talking to family members. Think of somebody who's an alcoholic. An alcoholic is always going to struggle with drinking alcohol. They can't do it. And it's going to be a lifelong struggle. They can learn to manage it. They can be very successful, but it's always going to be. But we would never say to the alcoholic, Bob, just, I know the answer to your problem. Just
Stop drinking, right?
So it's the same. We can't say, Nancy, just clean, throw stuff away.
No, it's not going to help.
so obvious. But the difference is that we have all been educated on alcoholism. So we know whether it personally impacts us or not. We all know what that person is struggling with. We haven't had the same education related to hoarding environments. So
That's true.
We can't relate to what's happening, and we don't know what to say, and we don't know how quickly their defenses can come up and they just shut you out and stop listening. So the more education we get, the better off we're all going to be. But it is important, check back. If you have a client that you think had hoarding behaviors at one point, recognize those behaviors do not go away. They can build new skills and learning patterns, but they're always at risk for relapse. So check back in.
But it doesn't when I think of the hundreds and hundreds and hundreds of bottles that were stowed, and I'm thinking, what the hell?
Yeah.
Oh God, it was, contractor bag filled up after contractor bag. And they're like, Karen, I'm like, this is a lot of things going on here.
It is. And you may think I think our natural instinct is to go, oh, I've got them back to sort of ground zero. It's okay now. They're safe. They're in an environment that's working. They're reduced risk of falls. There's a reduced fire risk. I think I feel good now. Things are good. But to the person that just saw all of their possessions leave their home, they are freaking out that they no longer have those items. Oftentimes, when you work with a client and you say, let's sort some items and we'll pick some items to save and we'll pick some items to discard. The items that you pick to discard, if they don't actually leave the home, and I mean leave the property, it's very common that later on in the night, the person will go back out and take the trash bags back in, because while they're excited and motivated at first, this is good, I want this to happen. The anxiety will eventually set in and they want those items back. So when they have those cleanouts, the person that had all those wine bottles, it's likely she went out and got more, or found they will even find where they are taken and go to the place and get them back.
Never thought about that. Oh my goodness.
Following up is really,
okay, thank
really
you.
important.
Thank you so much. This was incredibly awesome. Thank you.
You're welcome.
Lisa, there's a question about resources for low-income seniors. It says our local social services no longer helps with this because it's considered wasted resources. Do you know any?
I always tell people I would always start with your area agency on aging. Even if they are not doing something specific to this issue, they are likely to know who in your area is. And you all know about your area agencies on aging, I'm assuming they're partners, but they would be my first contact. Reach out, see what they know, and sort of go from them. For Arizona, my next step would be like Department of Economic Security. Your goal is to sort of find out who, and every place is different, so it's hard for me to answer. There are national websites that are full of resources. There are online support groups, which I think can be really helpful. That peer-to-peer support that I talked about, honestly, in those groups that I worked with, way more important than anything I said. It was the support from peers that was more important.
Thank you. I have another question. We were advised not to use the term hoarding because it's a clinical term. this person joined a little bit late, wondered if you had addressed that. We talked about it a little bit, but.
Right.
Talk about that
So,
anymore?
yeah, so you can say, so yeah, so don't call them a hoarder. Even if they say, oh, I'm a hoarder, and they kind of laugh it off, very common for them to do that. Don't say it. Don't say, oh, well, you're a hoarder, so this is what we're going to try to do. I have found that most of the people that I have dealt with are fine if you say something related to a hoarding environment. But if the person that you're dealing with is sensitive to that word in general, just talk about their clutter and just say, you know, we need to make you safe. Focus on safety. We need to make you safe. This environment really isn't great for you. You know, so you don't necessarily have to label the environment. You can just say your home, the environment, how you're living. You know, you can use words like that. But honestly, and I've had, you know, probably 300 people through my classes. Most of them are okay if we talk about a hoarding environment, but equally, they are not okay with being called a hoarder, even if they call themselves a hoarder. So.
Thank you for that. One last question, and then I think it's probably about time to wrap up. Is there a national website that you can recommend for resources?
I think you can do there's a lot of websites, so I'm not gonna recommend one over the other. I would look at the data that they're using and the date of the data. So try to find a website that has current data, because even some of the websites with hoarding disorder in the title of the website will still use old data. You know, like early 2000 data, you know, which is not the end of the world, but you might as well, if you're going to try to get some information, get some of the more current information. I think it can be more helpful. Remember that we've only been looking into this since like the 1990s, so there's not a ton of stuff out there. But there can be some really helpful stuff out. I highly recommend looking up anything that Dr. Randy Frost has done. I really personally consider him to be one of the leading experts in this field. And I feel that a lot of the information that he puts out is really written at a community level. Everybody can understand it. He doesn't make it really complicated or academic. He really speaks to it to a point where you can understand it, your client can understand it, and it just sort of puts all of us on the same page.
All right. Thank you. Well, that's all of the questions that are in the chat right now. And so unless anybody else has something, I think we're about done.
All right. Well, thank you very much for having me today. I appreciate it.
Thank you, Lisa. We really appreciate it. Obviously, with a lot of comments in the chat about how valuable this was. So thank you again. We appreciate it. So those of you who attended will be getting out to you the recording and the slides that Lisa used today. So thanks a lot. And all right.
Take care.
Bye, everyone. Bye-bye.